Take a good look at your fingernails right now. Go ahead, pause this video if you need to. Because hidden in those nails could be early warning signs of kidney disease that millions of Americans never notice. I'm Dr. Heena Ahmad, and today I'm going to show you 6 nail patterns that have been linked to kidney disease in medical research. One of them is especially easy to miss, yet it may be one of the most recognizable clues when it appears. Stay with me until the end, because I'll also explain what these signs can and cannot tell you, plus the simple tests that can give you real answers. Chronic kidney disease affects an estimated 35 to 37 million adults in the United States. Even more concerning, many people don't realize they have it because the disease often develops silently over many years. By the time symptoms become obvious, significant kidney damage may already have occurred. That's why paying attention to your body matters. While your fingernails cannot diagnose kidney disease, they may sometimes reflect changes happening inside the body. Think of them as warning lights on a car's dashboard. A warning light doesn't tell you exactly what's wrong, but it tells you it's time to take a closer look. These nail changes deserve extra attention if you have diabetes, high blood pressure, are over the age of 55, have obesity, smoke, or have a family history of kidney disease. If any of those risk factors apply to you, today's information could be especially valuable. Let's begin with the first nail pattern. Number 1. Pale or whitish nail beds. Healthy nail beds usually have a soft pink color because they're supplied with oxygen-rich blood. As kidney disease progresses, the kidneys may produce less erythropoietin, a hormone that helps your body make red blood cells. Lower red blood cell production can contribute to anemia, making nail beds appear unusually pale. Of course, pale nails don't automatically mean kidney disease. Iron deficiency, vitamin deficiencies, blood loss, and other medical conditions can also cause similar changes. But if pale nails appear along with fatigue, shortness of breath, or known kidney risk factors, it's worth discussing with your healthcare provider. Number 2. Brittle, dry, cracking, or splitting nails. Have your nails become more fragile than they used to be? Brittle nails are common as we age, but persistent dryness, cracking, or splitting may sometimes reflect changes in mineral balance or the buildup of waste products when kidney function declines. Again, this isn't specific to kidney disease. Frequent exposure to water, harsh chemicals, thyroid disorders, or nutritional deficiencies can also weaken nails. The important point is persistence. If the changes are new, continue for weeks, and occur alongside other risk factors, they deserve attention. Number 3. Terry's nails. Terry's nails appear mostly white, with only a narrow pink or brown band near the tip. Doctors have observed this pattern in several chronic illnesses, including liver disease, heart failure, diabetes, aging, and sometimes chronic kidney disease. Because it can have multiple causes, Terry's nails should never be used to diagnose a kidney problem on their own. Instead, think of them as another clue that may prompt further evaluation. Number 4. Beau's lines. Look closely across your fingernails. Do you notice horizontal grooves running from one side to the other? These are called Beau's lines. They develop when nail growth temporarily slows after the body experiences significant stress, severe illness, surgery, infection, or other major health events. If kidney disease becomes severe enough to place stress on the body, Beau's lines may appear. However, they can also develop after many unrelated illnesses. What's important is recognizing them as evidence that your body has experienced a period of stress worth understanding. Number 5. Changes in the lunula or vertical ridges. The lunula is the pale half-moon shape at the base of your nail. Some people notice that it becomes difficult to see, while others develop more noticeable vertical ridges running from the cuticle toward the fingertip. These findings become more common with aging and are usually harmless. However, in some people with chronic medical conditions, including kidney disease, they may become more pronounced because of changes in circulation, nutrition, or overall health. By themselves, these changes are usually not alarming. It's the combination of multiple signs together with known risk factors that deserves closer attention. Now let's talk about the pattern many viewers have been waiting for. Number 6. Half and half nails, also called Lindsay's nails. This is one of the most recognized nail findings associated with chronic kidney disease. The lower portion of the nail near the cuticle appears pale or white, while the upper portion becomes pink, reddish, or brown with a distinct horizontal dividing line. Researchers have described this pattern in people with advanced kidney disease for many years. It doesn't appear in everyone, and having it does not prove kidney disease. But when doctors see this finding together with abnormal blood tests or other symptoms, it can provide another valuable clinical clue. Because this pattern isn't commonly discussed outside kidney medicine, many people simply assume it's a normal variation and never mention it to their healthcare provider. So why do kidneys affect the nails at all? Your kidneys are far more than filters. Every minute, they help remove waste products, balance fluids, regulate minerals like sodium and potassium, help control blood pressure, activate vitamin D, and produce erythropoietin, the hormone responsible for healthy red blood cell production. It's also important to understand what these nail changes cannot tell you. They cannot confirm kidney disease. They cannot tell you how severe kidney disease is, and they cannot replace proper medical testing. Many perfectly healthy people have ridged, brittle, or pale nails. Likewise, many people with chronic kidney disease have completely normal-looking nails. That's why laboratory testing remains the gold standard. If you have diabetes, high blood pressure, a family history of kidney disease, or you're over 55 and notice persistent nail changes, talk with your healthcare provider. 2 simple tests can provide much clearer answers: an eGFR blood test to estimate kidney function, and a urine albumin to creatinine ratio, often called urine ACR, to check for early kidney damage. The earlier kidney disease is detected, the more opportunities there may be to slow its progression through evidence-based treatment and healthy lifestyle changes. So what can you start doing today? First, examine your nails about once a week in natural light without nail polish. Compare several fingers rather than focusing on just one nail.